Big Money Bound TV, RRT Posse YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. Today's video is a subscriber requested video. I got a request from The request comes from Candace Dunn. She said, I'm a new grad, so thanks for the tip. You're welcome. Thank you for being thankful. Could you do more videos on how to build critical thinking skills? I know that builds with experience, but anything would help. Now, like you said, building critical thinking skills, that comes with like experience, just years in the healthcare field. But it is possible to learn critical thinking skills without having as much experience. And I'm willing to tell you. But you gotta be willing to do something for me now. And that is, keep watching. Just keep watching. What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound.
The kids, man. You got the kids, man. Critical thinking skills can be learned without experience by asking questions to a therapist that does have experience. So you don't need the experience. You got to ask somebody who does have the experience. So all you got to do is just ask questions that go for students, that go for new grads. Ask questions. When you in that respiratory therapy program, man, and you're precepting at those hospitals, ask as many questions as you possibly can. There is no such thing as a stupid question. I don't want to ask a question because I don't want to look stupid. You're actually looking stupid by saying, I'm a respiratory therapist student that doesn't want to ask a respiratory therapist questions. That looks stupid. So let's not look stupid at all, man. Ask these questions. Here's a good example. You're with your preceptor while you're in clinicals. You want to gain like critical thinking skills, but you don't have much experience. But your preceptor is a therapist, so they have experience. You ask the question along the lines of, when was the time that you were like most afraid in a situation as a respiratory therapist? This can be a situation where obviously something went wrong. They had to try to figure out what was going on. Critical thinking was needed. So you're going to get these gems and jewels that they drop in you just by listening. Here's an example. Well, they may tell you, well, I remember I was intubating, a patient needed to be intubated. The doctor said he wanted a 7.5 ET tube. I gave the doctor the 7.5 ET tube. The patient airway began to swell. The doctor then said, let me have a size 7 ET tube. Good thing I had a size 7 ET tube on standby. That ET tube wasn't able to go in as well. So we then had to bypass the upper airway and do an emergency tracheotomy. Emergently, like it was very urgent. Good thing I also always keep a size 6 trach whenever I'm intubating a patient. God forbid something happens and they're unable to intubate and we got to bypass that upper airway like we had to do. It's a 1 in a million chances that this will happen, but I'm thankful I was prepared for this situation. Bam! That's great knowledge to have. Now you picked up all that as a student asking questions. Now what you think that you're going to do when it's your turn as a therapist to intubate a patient? You're going to have a 7 point, you're going to have an ET tube, whatever ET tube the doctor asks for, you're going to have a size below that, and you're going to always have you a Shiley trach or any kind of trach XLT, but you're going to have an emergency trach just in case the upper airway needs to be bypassed. That's critical. That's a part of like you thinking. That's a part of critical thinking before the emergency even get there. And you learn that just by asking questions. This is like the easiest way to do it is ask question. Ask the preceptor. What do you think is most important that a student must know when coming out of the respiratory therapy program? Therapist may say something along the lines of, oxygenation is key. Remember, we're the patient's lungs. So when you go into a room, don't go to looking at this piece of equipment, that piece of equipment. You look at your patient, you get that saturation, you get their skin tone, you get their work of breathing. Are they turning blue? Do they need oxygen? Because either we got to give them the oxygen through a BiPAP, intubation, high flow nasal cannula, regular nasal cannula, venti mask, simple mask, lung breather. Our job is making sure these patients can oxygenate to help in the lungs. That's the nitty gritty. We here to oxygenate. We provide oxygen. Either way, you asthmatic, get a nebulizer, open up your airway so you can breathe better. This is all oxygenation. This is breathing. But you won't get these answers unless you ask questions. And I tell you no lie. If I could go back, I would ask so many questions, knowing what I know now. And that's just like a part that comes with the field. You can ask the question of, when you came out of the respiratory therapy program and it was your first day alone on a job as an RT, how did you feel? Now, if somebody tells you, I felt like I was doing it for years, I wasn't scared at all, I hit the ground running, I was taking care of this patient, that patient, they lying and they scaring me. You're a new respiratory therapist doing a job. People's lives are in your hands. Your decision making determines the outcome of a patient's treatment, care plan. You could hurt somebody, you can help somebody. And you telling me you ain't somewhat scared at all? Oh well, I worked in a hospital before. I was a respiratory therapy tech. I cleaned all the vents and this and that. It's nothing like that real deal experience once you really end up with somebody's life in your hand. Let's say you buy a new car. We all been driving. You've been driving for the last 10, 20 years. Okay, cool. But when you get inside that new car, you gonna come out that dealership parking lot a little bit more smooth with a little bit more caution, because that's your new car. Saying when you can walk to the respiratory therapy care field, this is your new career. You gonna come in there. You ain't gonna. So by asking that question, it's gonna put you at ease, because you're a student. You finna be a therapist soon. You're gonna be on your own soon. And I tell you, when I first came in here, I was petrified. I was scared. The way you feeling right now, that's how I felt. But now I'm doing a job nice and easy with no problems. That's gonna put you at ease. So asking questions can go a long way. Like, man, ask questions. Get that experience, that knowledge that someone else has, and you just add on to that as you go. Like I said, that intubation situation, get the tube, the ET tube that the doctor needs. You get a size below that in case that's too big, and you always have an emergency trach available. That's golden information. Like, that's golden. Like, you can't go wrong with that. And then critical thinking, critical situations. Practice. How can you practice a critical situation? Keep listening. Let's say I love basketball. Everybody dream as a kid is to make the game-winning field goal at the end of the fourth quarter. When you grab the ball, 5, 4, 3, 2, you putting all that pressure on you. You put yourself in a critical situation. It's crunch time. It's go time. How you do this as a therapist? Easy. All these webinars, these websites. Number 1, Kettering. I cannot stress. You use Kettering. Kettering has like a huge bank of like critical thinking, like real life respiratory therapy situations that they put you in, and you gotta like try to solve that issue. A patient came in, a drowning victim. We got a patient that was in a burning building. We got a patient that just was found down, and you gotta pick, okay, what do I do here? What do I do there? What do I do there? So you put yourself in a critical situation, and you're getting practice. It's not real, but it's critical, and you practicing. Like you would if you're a kid that loved basketball doing 5, 4, 3, 2, 1. This is for your critical skills. You put yourself in a critical situation. You log onto the website, put yourself in a critical situation, and now you're getting your practice in. That's it. And besides Kettering, you got the NBRC.com. You can actually take the NBRC practice board exam, where they're going to give you similar critical thinking questions that are going to be on the actual state board exam. Like, this stuff is golden information and is in your hand. I'm giving it to you. Like, that's Candace, man. Thanks for asking this question. That's a great question. This is how you can build your critical thinking skills without the necessary experience. You feel me? By putting yourself in these situations. NBRC.com. You take that practice exam. You take that simulation course. That's what it's called. The simulation part where they give you like, this patient is this size. We need a vent setting. We need ABGs. What do we do next? What do we do now? That's all part of critical thinking. And one of the last things I have for you that you can do is, man, what you doing right now? YouTube. 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 When I started my YouTube channel, it was only like one really respiratory therapist, two at the most doing respiratory therapy video. I was like the third person. Now you get on here, it's 4, 5, 6, 7, 8, 9, 10 people. Shout out to them. It's possible. RRT Posse. I want to see it keep going up. Everybody was saying, Randy, you always doing a good job. We need more. We need more. I agree. So now that we have more, let's support more. You feel me? Go on YouTube. Watch all these videos about First Cold Blue, how to intubate, ABGs, critical thinking, how to interpret ABGs, floor therapy, nebulizer treatments, how was the program. Every video I'm talking about is a video that I have. All this stuff is on YouTube, man. And like you did, you drop down in the comments and you ask the question. And I gave you the knowledge and information that I had. That's the most important. Ask these questions to get these critical thinking tips and skills. They're going to put you in that situation. Let me give you one more critical thinking situation I was in before I go, man. Where something was needed. Okay. Critical thinking. I got so many I want to pick a good one for you though. Right here. I was in an emergency room. A patient was intubated. I then had the nurse bag the patient from the tank. The tank began to run low. I'm setting up my ventilator. I'm hooking the oxygen into the wall. I don't know if anybody has ever had this problem. If you have, please drop down in the comments and let me know. When inserting the oxygen port into the wall, it kept shooting out. It would not stay attached. It wouldn't stay. So the patient could not go to the ventilator because we didn't have the oxygen flow and the tank was running low. This is critical thinking skills. Obviously, we can't stay in this room because this O2 wall meter thing is not working. We got to change rooms. But in order to change rooms, we need another tank. But this tank is empty. Critical thinking. We need another tank. This patient's finna crash. What's going on? Every cold cart in the hospital is supposed to have a full tank on it. We had a cold cart in the room because we just had a cold from intubating that patient. Grab me that tank off of that cart. Hand me that. I hooked up the vent piece to the tank. Hooked the patient up to the vent, and we transported that patient from that room right across the hall to a room that had a port in the wall that worked. That was critical thinking. So now you saying, oh really? So during the cold, every cart has a full tank? Thanks for letting me know that. You're welcome. Like this. I love it, man. So if you ask these questions, anybody that loves the field of respiratory therapy, not even love it. If you're a respiratory therapist, that just care about respiratory therapy. You're a therapist, you're doing your job. If someone asks you a question that you know, you're gonna give them the game. I'm just speaking from my point of view, I guess. Because if you ask me a question, how do I treat a COPD patient? You don't give a COPD patient more oxygen than they need because then they dry to breathe. It's gonna be knocked down. I'm gonna give you that. Maybe that's just me, man. Thanks for watching. RRT Posse, I got us. Any questions, any videos you would like from me, drop down in the comment and I'm gonna get to it eventually. I got videos from 2-3 years ago that I'm gonna get to eventually. Thanks for watching.